we'll go straight on, if that's all right, to Robin. So Robin is an assistant professor in mathematical epidemiology at the University of Warwick, interested in developing and analysing mathematical models for planning interventions during epidemics. Please go ahead, and we'll give you about 10 minutes, Robin. We'll give you a full 10 minutes.
Thanks very much, Deirdre. I will just share my screen. Perfect. Thanks very much. Thanks very much to the organisers for the opportunity to say a few words about some of our work looking at evolutionary implications of vaccines, and in particular linking within host and between host models. As Deirdre said, I'm an assistant professor in Warwick, and my main research interests are in using epidemic models to help guide interventions at different stages of an outbreak. So early in an outbreak, I'm interested in questions like, are initial cases going to lead on to a major epidemic with large numbers of cases, or are they going to fade out as a minor outbreak with very few cases? And which interventions can be introduced in order to reduce the risk of getting a large epidemic? And then in the middle phase of an outbreak, I'm interested in questions like how effective are current control measures, and which interventions are going to minimize numbers of cases or numbers of deaths going forward. And then towards the end of an epidemic, or towards the end of an epidemic wave, I'm interested in questions like how should interventions be lifted? And if you haven't seen a case for the last 2 weeks, then does that mean the epidemic's over so that interventions can be lifted completely? Or might the outbreak still be ongoing in individuals that simply aren't reporting disease? And in most of these types of analysis, epidemic models are used, but they're used in such a way that you focus on the effects of interventions on future numbers of cases or future numbers of deaths. So you might put together, for example, a compartmental model in which you have a period of intense interventions, and then you might be looking to project what's likely to happen if you remove those intense interventions, in which case perhaps the number of infected individuals or the numbers of cases you see might be expected to grow. And you can have more complex models with more complex interventions in them if you want to. So as an example, in the bottom left, there's some work being led by Mike Tildersley in Warwick. And in this work, he's looking at, in this particular example, numbers of cases and numbers of deaths under different, more complex control interventions. In this case, a sort of tiering of control measures and what happens as you lift those tiers. But in both these examples, the key thing here is that there's no sort of evolutionary implications being considered at all, whereas exactly what your control intervention is can have very significant evolutionary implications. There's an example of this on the right-hand side here. So on the right-hand side, what you see is an outbreak where you have two different types of the virus. You've got a wild type, the original virus that perhaps started the epidemic, and then you have a variant here, in this case, a vaccine escape variant. And the effect of introducing a vaccine is that transmissions by the wild type pathogen are reduced, but transmissions by the vaccine escape variant are not reduced as much. So in other words, by deploying the vaccine, what you're doing is you're blocking some wild type transmissions, and that leads, whereas the vaccine escape variant can sort of spread around the population, and that leads eventually to an infected population that's dominated by the vaccine escape variant. So in other words, by introducing your vaccine, there are significant evolutionary implications. It's not sufficient just to consider purely the number of cases or the numbers of deaths going forward while ignoring these evolutionary implications. And I think when thinking about the emergence of, in fact, any sort of variant, not just a vaccine escape variant, but any sort of variant of concern, it's useful to think of two distinct stages in that process. So the first stage is a stage whereby you have your infected population, which is infected by the wild type. And the first thing that happens is you get the appearance of a variant of concern. That's step one. And then step two is the establishment or not of that variant of concern in the population. So in other words, the variant of concern going on to spread widely in the population. And that depends on a number of different factors. But whether or not the variant of concern goes and spreads widely is a stochastic process. It could simply fade out with very few cases, in other words, not establish in the population, or it could go on and spread widely and establish in the population. So I think thinking of these two stages is useful, and in what follows, I'm going to be talking mostly about this first stage, the appearance of a vaccine escape variant. And that was the feature of some work that we've been doing recently, looking at the risk of vaccine escape variant appearance in a population. And there are different effects, some at the within host level and some at the population scale. And the one that we focused on in this sort of correspondence to Lancet Infectious Diseases that we put together recently was all about a kind of population scale effect. Specifically, it was about the effect of the number of cases you've got. And the basic underlying idea is that if you can see up here, there are 6 individuals that are infected by a wild type. That simply provides 6 opportunities for a vaccine escape variant to emerge, because there are 6 infected individuals, and a vaccine escape variant could in principle appear within any of those 6 individuals. Whereas, of course, if you have a lot more infected individuals, then that simply gives a lot more opportunities for variants of concern to emerge. And so the key output from this very simple letter that we put together is that reducing numbers of cases is really important if you want to reduce the risk of vaccine escape happening. And that's what this figure here shows on the left-hand side. So in other words, going forwards, as the vaccine is rolled out, it's really important to keep case numbers low using a combination of non-pharmaceutical and pharmaceutical control measures. So that's kind of population scale effect, this population scale effect that reducing case numbers at the population scale minimizes the risk that variants of concern arise. Within host, there are different effects too. So as an example, it could be the case that if you have a weak vaccine, then that leads to minimal selection pressure for a vaccine escape variant to arise, and therefore a low vaccine escape risk. On the other hand, if you have a very strong vaccine, then what you do is you suppress the virus to low levels. And so you get a similar effect to the population scale effect that I showed on the previous slide. If you suppress the virus to low levels, then there's a low mutation supply. And again, there's a low vaccine escape risk. And so if you have infected, vaccinated individuals, then it could be infections of individuals where there's an intermediate vaccine immune pressure that leads to the highest likelihood of seeing a vaccine escape variant emerging. But anyway, the key message from this slide is just that there are within host effects as well as population scale effects. And so something that's important is to develop methods for linking these within host epidemiological and evolutionary dynamics with between host dynamics too. And so one example of how to do that is some work that's been done by my PhD student, Will Hart. He's been looking at linking within host viral load curves with population scale dynamics. And so the idea here is that you might have fitted a model to lots of different individuals in your population to look at the viral load and how that changes through time in different infected individuals. And what you want to do is you want to scale from those within host dynamics to then make a prediction or a projection as to what's likely to happen at the population level. You want to predict the numbers of cases each day based on what you know about the within host dynamics. And so one way to nest these within host dynamics in population level models goes right back to the 1920s and to Kermack and McKendrick. So one way that you can nest these sort of infectiousness curves, so in other words, a sort of within host process in a population level model, is simply to include in your model this function here, this sort of within host infectiousness function beta, which describes the infection rate of an individual who's been infected for X days. So that's one way that you can do it. You can solve this model, and as your output, you can get numbers of susceptible individuals or numbers of infections per day. But what Will instead did is he looked to use a slightly different approach, which is entirely analogous to this integrated differential equation model, but perhaps it's slightly simpler in that it's just a very basic compartmental model. What he did is he took the expected infectiousness of individuals in the population, so that's this black curve here, and then what he did is he simply discretized a compartmental model. So he split the compartmental model into a number of different compartments, one after another, where individuals in the different eye compartments infect susceptible individuals at different rates. And that infection rate is determined exactly by this within host infectiousness curve. So in other words, if you have an individual in the first compartment, well, in this particular example, their infectiousness, it looks like it's about 0. If you have an individual in the second compartment, then their infectiousness is set according to the average value of the within host infectiousness curve over this time period here. Individuals in I3, their infectiousness is determined by the average value of this infectiousness curve in the third compartment here, and so on and so on and so on. And one of the things that Will proved is that if you take the limit of the number of compartments here to infinity, then what you retrieve is you retrieve exactly the Kermack and McKendrick basic model. And one of the kind of benefits of this approach is that it can really easily be extended to a situation where you might be considering the emergence of different, or the appearance of different variants in a population. And so that's work that's currently being done by Veni Karamitsu, one of Julia Gogg's PhD students in Cambridge. And essentially what you have is you have exactly this compartmental framework that I described on the previous slide, if you consider just the top row of compartments. So if vaccine escape variant appearance doesn't happen, then an infected individual simply passes through these different compartments, where individuals in these different compartments will generate new infections at different rates. So this is exactly the same as the model on the previous slide. But the key addition here is that there's also the possibility that within an infected individual's course of infection, that a vaccine escape variant appears. So in other words, an individual during their first day of infection, there's some probability that they transition down here, and then they progress along this course of infection here, reflecting the fact that within the first day of infection, a vaccine escape mutation happened within that individual. And so this sort of gives you a way, if you want to take this very basic compartmental modelling framework and then include vaccine escape variant, or indeed any sort of variant appearance in the population. So I'm going to stop there, and I guess the main take-home message is that methods for scaling from within host dynamics to population scale dynamics are very important and can be used to address lots of different questions relating to pathogen evolution. Epidemiological models are often used to plan interventions during epidemics, but the focus is often on future numbers of cases and deaths. When considering these types of interventions, it's important to consider pathogen evolutionary impacts. There's an interplay between within host and population scale processes. As one example, you might have vaccination strategies that reduce cases at the population scale, but perhaps they lead to increased selection for vaccine escape variants at the within host scale. And so in order to explore these kinds of things, it's really important to develop epidemiological modelling approaches for scaling from within to between host dynamics. And as I just briefly mentioned at the end there, the kind of basic methods that already exist can be extended to explore the risk of escape variants appearing in the population. And escape variant appearance is a key component of escape variant emergence, which is made up of both the appearance of variants of concern, but also their subsequent transmission around the population. So I'm just going to stop there and hand back to Deirdre. So thanks very much.
Thank you very much, Robin. We're bang on time, so I think we won't take any questions from those introductory talks, but thank you both. Those are really framing the discussions very helpfully. And I think we'll have some interesting discussions about what is an optimal intervention, so I'm looking forward to that.